Good afternoon, everyone, and welcome to our webinar, Mitigating Musculoskeletal Disorders in Personal Support Workers and Improving Client Mobility. My name is Henrietta Van Hall, and I'm the Executive Director of the Health and Community Services team at PSHSA, or the Public Services Health and Safety Association. And this community of practice is a joint venture between PSHSA and CRE-MSD, which is the Center of Research Expertise for the Prevention of Musculoskeletal Disorders. We're thrilled to have three very experienced presenters with us today. I do have to apologize that we do not have the webcams working today. It's not that I'm having a bad hair day. It's totally a technical issue. So because we've got three presenters and a lot of content to cover, I'm going to move right into introducing them so they can get started. So we have Dr. Catherine Brookman with us. She's the Associate Director at CRE-MSD for Knowledge Translation and Exchange, and she's a gerontologist. We have Dr. Sheila Ritcey, the President of the University of Toronto Physical Therapy and Occupational Therapy Alumni Association, and she's an occupational therapist and a physical therapist, and she teaches personal support workers. And we have Emily King, who is an engineer, and she's also a PhD candidate at the University of Toronto and the Toronto Rehab Institute with the University Health Network, and she's also a MITAX funded fellow with the University of Waterloo. So over to our presenters.
Here we go. Thank you, everyone. I just want to make sure everyone can hear me. No news is good news. Okay. Well, I'm Catherine Brookman. I'm pleased to be here with you today. And I'd like to give you a little bit of background around injury rates and personal support workers. So as you know, home care workers have higher rates of injuries as compared to many other occupational groups, and they also experience many symptoms of musculoskeletal disorders. Information on the incidence of work-related injury of personal support workers, however, is not directly available. The WSIB reports data on the incidence of work-related injury and disease for all community healthcare workers in Ontario, including the regulated health professions, or refers to assisting professions in support of healthcare, but it is not possible to delineate PSWs alone from this data. And as a result, the Ministry of Labour funded 2 years ago a research study entitled Keeping PSWs Safe in the Changing World of Work. And I had the privilege of working with a team of researchers, Zetanoglu, Denton, Vanderbent, Boucher, and Davies, and we were able to produce the largest Ontario-wide health and safety PSW community research. We did have an advisory committee, and I think it's important to know because they helped to inform the questions and the pre-testing of the survey. Public Services Health and Safety Association was involved, as well as two very large unions, SCIU and CUPE. And it is very significant that we had 2,341 respondents to a 28-page, over 100-question survey. And just for your own interest, there is a lot of data that is available in a lot of different areas on the website called pswshaveasay.ca. And you may wish to have a look at that after this presentation. So today I'm just going to give you a quick overview of data related to musculoskeletal disorders. So what did we find out from this survey related to musculoskeletal disorders? When the survey participants were asked how often had you each of these conditions in the past 3 months, 17% indicated that they had back pain either most of the time or all of the time, and 1 in 5 indicated pain or discomfort in the neck or shoulder, and 14% indicated pain or discomfort in the elbow or hand. What is particularly significant is that in the last 12 months, 16% of PSWs reported that they have been injured while on the job. And when we distilled down what type of injuries those 16% had, indeed 56% reported that they had a work-related injury due to repetitive strain. And we did give them a definition in terms of repetitive strain. And for all of the PSWs, the 2,300 PSWs, when we asked them what was their history of being injured in their career as a PSW, 53% indicated that they had been injured while moving clients. So we know that there's been significant changes in community care work. Work has intensified significantly over the last 3 to 5 years. And the PSWs reinforce this in their responses to the questions. We certainly saw that their workload was heavier, there was more pressure for them to do more in less time, the clients required more care. And the skills required to do their job had increased. Particularly, 1 in 2 of them indicated that they were likely to perform delegated tasks from a physiotherapist or an occupational therapist. In terms of those delegated tasks, we were interested in the training. And 61% of PSWs agreed or strongly agreed that they got enough training to perform the delegated tasks from nurses or supervisors, and that decreased to 52% when asked if they had enough training from physiotherapist, occupational therapist. 52%, I'd like to indicate, is not high. When you're getting service from a PSW, you're looking for close to 100%, indicating that they're getting significant amount of training. Now, those who actually did receive training, 88% said they felt confident to perform the tasks required to do their job. So we do know that training is an issue. Now, specifically related to training on safe client lifting and transferring, and we're going to hear some framework knowledge to help us with this type of training shortly. We learned that 77% said their organization provided them with enough training on safe client lifting and transferring techniques. However, only 68% indicated that they were able to seek assistance when faced with heavy client lifting demands, and only 56% indicated that they had access to assisted devices. Finally, I'd like to comment on the information related to support from supervisors. PSWs indicated quite strongly, almost half of them indicated that they were not getting sufficient personal contact with their supervisor, that opportunity to speak with their supervisor certainly could be better. Only 66% reported that they had the opportunity to talk openly with their supervisor. And for 60% of PSWs, their supervisor was not available 24/7. 87% felt that they could certainly, with comfort, report a health and safety concern, and 71% did indicate that there was a process to access assistance. So overall, we are seeing a trend that while we are expecting PSWs to respond to client demands, in particular with this presentation related to safe lifting and transferring, they are not getting enough training and or the support that the organization needs to provide. So I'm now going to hand it over to my colleague Sheila Ritcey, who can share with you some potential factors related to a framework that will help us deal with these inadequacies.
Thank you, Catherine, and good morning, everyone. It's Sheila Ritcey, and I'm going to talk a little bit about the skills that are essential for proficient mobility and safe handling. And we're going to take a little look at a framework that I think is useful. The framework actually comes from the United Kingdom, but it, I think, puts into a context the kind of skills that our PSWs would exercise when they're actually working with a client. So the standards for the 21st century, as I'm sure you all know, the P21 standards focus on knowledge, skills, and attitude. So I'm going to take a brief look at the knowledge, first of all, that we expect our PSWs to acquire in their training programs. And as you all know, there certainly are some inconsistencies in training programs, but this looks at the base knowledge that we would expect a PSW who's been well trained to take into the workplace, and hopefully that really should help reduce injuries. So first of all, they need some background in human movement. So we usually focus on 5 body systems just to remind them that this is an integrated process when people move, that it is not just one body system, that if there's an issue with one system, it's certainly going to affect the others. Also would emphasize the benefits of mobility, because the ability to move adds so much to quality of life. It helps people not only react to their environment, but it gives them the capacity to shape their environment. And if PSWs are assisting with quality of life and capacity of building and restorative care, it's essential that they have a good understanding of mobility. So we look at the physical benefits of mobility, which are kind of self-evident, the social benefits of being able to move, to go to different places, to interact with people. We look at the psychological benefits of mobility, being able to change your environment, to respond to your environment, and the self-esteem and all the good things that go along with mobility and building self-esteem and allowing self-determination and people able to make decisions and act on them. And of course, backs. As we all know, good back care is essential for our PSWs. So a basic understanding of the back and how it works, and the curves, the natural curves of the spine and how important they are, whether you're standing, sitting, walking, sleeping, and driving. I think we sometimes forget that our community workers spend a lot of time in their cars, so some understanding of backs and the whole issue of driving. I think that good education in the understanding of their backs and how they work, and the issue of, when I say spinal curves, where the position of their chin, so that they keep that chin in a neutral position, that they don't exaggerate curves of their back and they don't flatten those curves, that they have natural positions. Posture, big emphasis on posture when we're training PSWs, both for themselves and for their clients, because if they have good posture, that certainly is a good start to protecting their backs. So understanding the position of their back and how best to protect that back. Gravity, we always emphasize, make gravity your friend. We want gravity to work for them, not against them, and understanding the impact of gravity on equilibrium and balance, making sure that they have a proper base, making sure that the line of gravity is within the base, and emphasizing also that a shared base. If they're working with the client, even more important that they're very aware of the shared base that they are occupying. And I know we've got lots of ergonomists online here, looking at the fact that they work in the center, that they don't work at the extremes of their base. Biomechanics, the whole issue of leverage, working with effective and efficient body movements and using leverage to help move people, using their body weight, using the big muscles as opposed to the small muscles. So big emphasis on biomechanics and defining it really as effective and efficient use of their bodies in a way that protects the health of their bodies. Oh, sorry, having a little trouble with the... Well, so that's a basic summary of the skills that I think we would be including in any kind of a program for PSWs, or the knowledge. Now we look at transferring that knowledge into skills. And I've looked at 5 issues here. The first one, positioning, that they assist people to be in the proper positions, whether that's in a bed or in a chair or in a car, so that they have an understanding of positioning and move people safely into proper positions. Transfers, very important part of their work. Sitting to standing, considered one of the most important things they do, and that transfers are a therapeutic activity because the client is actively involved with them. So obviously we look at the differences between a lift and a transfer, and for them to understand the importance of using transfers because it involves the client remains part of that activity. And lifts, whether it's a person lift or a mechanical lift, again, understanding the advantages and the disadvantages of lifts, because when you move to a lift, the client is no longer actively involved or minimally involved, and they're deconditioning. So lots of attention to the different kinds of transfers. And I think we also look now at the psychological and the physical impact of using transfers. So we look at the discomfort of certain kinds of transfers for both the caregiver and the client, the very close proximity that people are in when they're using a transfer. So a lot more attention to what kind of transfer we use and the impact on both the caregiver and the client. Mobility aids, I would like to spend the whole seminar talking about mobility aids. Mobility aids, sadly, are considered a large contributor to falls. So I think what we want all our PSWs to understand is the proper use of mobility aids, that the person has appropriate mobility aids, they are using it properly, that their elbow is at the right angle, and that the mobility aid is being used in a safe manner. I certainly see a wide discrepancy in people's understanding of mobility aids, so a huge issue, and obviously a PSW can't change the height of a mobility aid or the kind of mobility aid, but they can talk to their supervisor and say they have some concerns about the way that that mobility aid is being used, and that maybe someone needs to come out there and assess it. I put assisted walking in here because so much of assisted walking is not done appropriately, where we're steering the client rather than walking with the client. So lots of attention globally to assisted walking. And I did review global materials for this presentation. So making sure if they're assisting someone to walk, that they're doing it on the right side and with the right grips. So we've looked at knowledge, we've looked at the kind of skills that knowledge translates into, and finally we look at the attitude, because if we've trained a PSW properly, we would hope to see a certain attitude in the way they view the world. So they're doing with, not for. That capacity building, restorative care involves doing things with the client, if possible, not for, because when you do the for, if they don't need it, you're into learned helplessness and learned dependency. So making very clear that they're doing with if they can do with. Restorative care capacity building, a global term used all over the world now for PSWs, that we are helping people to hang on to their independence and encouraging independence and quality of life. Dignity of risk, the emphasis we have on personal choice and self-determination, and very difficult sometimes for PSWs in the community where clients are making choices that they know are putting that client at risk. So helping them to have the tools to work with clients in this situation and report things to their supervisor if they think it's necessary. I've put in the term balanced decision making because it is a term used in the UK when they're making decisions about how to move a client, and it involves looking at the human rights and the needs of both the client and the caregiver, and that the decision is unique to the client. They don't make blanket policies much in the UK. Decisions about how a client is to be moved is unique to that client and considers both the caregiver and the client. So a very, very measured attempt to ensure that the right skill is being used and that that neither the client nor the caregiver is at risk. I've included a framework here, which I have used now with PSWs, to plug a client into, to look at if you are helping a client to move, where do they fit in this framework? And we have to go through this very quickly, but it is used in the UK, and I do find it quite useful. So if you can picture a personal support worker looking at a client and what their needs are, they go through this checklist. First of all, why does that person need to be moved? Maybe they don't need to be moved. Maybe they can move themselves. And if you are going to assist them to move, what's the justification of the strategy that is chosen? And have you chosen the one that's most likely to succeed? A very interesting process to go through with the PSW when they're working with clients. A risk assessment. And we won't go into details here, but so that a careful risk assessment has looked at the task, the individual caregiver, the load that's being asked to be moved, and the environment, because we all know, and Emily, who you'll be hearing from soon, is very interested in the difficult environment of washrooms. And for those who work in the community, this is a very difficult environment often to work in. The application of biomechanical and ergonomic principles that the PSW is using the most effective and efficient methods to help move that person. The optimal start position, which is a term I use now and it seems to be used very widely. What's the best position from which the person is most likely to succeed? And from sitting to standing, we're going to emphasize edge sitting versus chair sitting. And these terms are being used widely now, so I find it important that PSWs understand these terms and how to use them. The hierarchy of approach is just something for the PSW to look at. It's a bit like the functional independence measure, where we're looking at someone who can, at the top of the scale, they can use normal movement patterns and they don't need any assistance or any equipment. And we go down that hierarchy to needing both a person and equipment. And the next category is the person ability criteria. Does that client have the physical and cognitive skills to perform the task that you're asking them to do? And the one that I think we're all very familiar with is preparing that environment, getting rid of risk factors, safe equipment that they know how to use. So that's getting the environment ready. Preparation of the caregiver, that the caregiver is looking at their posture. Are they in the appropriate position? Do they have the proper base? Are their feet in the direction that they're going to help move that client? And most important, that they're using appropriate holds. And finally, person instructions to complete the task, that those instructions are clear and they encourage that person to do as much as possible. Again, using appropriate holds. And again, we're looking at the ability to support people without physical or psychological discomfort, obviously avoiding bruising or shearing. So instructions have to be very clear. And finally, when you complete the task, that person is safe and comfortable. And again, we encourage PSWs, after they've done a task, to think about any risks or controversial techniques that they actually used. New terminology may not be new to any of you, but edge sitting and chair sitting, very important terms that they should know. The optimal start position, no matter what they're doing, that they start from the optimal start position. And commands that we now much more frequently use. Instead of, do something on 3, we say ready, steady, sit, stand, walk, roll, that the last word is an action word, and it does seem to work. PSWs seem to support that it works very well with clients. Risks and controversial techniques that we're addressing carefully: no gripping that threatens skin integrity, the use of flat palms, no pulling on clients' arms or shoulders, which can injure a client's shoulder and neck, avoiding placing hands or arms under the axilla and using the shoulder to pull a person, not using walkers to move from sit to stand, and there'll always be controversy about that, but the ideal is not to use the walker, to move from sitting to standing and then put your hands on the walker, and not using people's clothes to initiate movement. And although we kind of gasp and say, well, we don't do that anymore, unfortunately, yes, we do, right? So that's just a very quick review of how we are training PSWs, hopefully to help get the best results and to keep them safe and their clients safe. And now I'm going to pass my headset over to Emily, who will talk about putting it into practice.
Sheila, before you leave.
Just a second, that was Sheila before you leave.
We have a question from
Chris.
Do PSWs use transfer belts in Ontario?
They do in some places, yes. And as long as they're used properly and fitted properly, I think it's fine. But they need the proper training, they need the right belt, and unfortunately, I think sometimes they're not used properly. But yes, there are places that are using transfer belts.
And we do have one other person who's typing a question, if you could just hang on for a couple of seconds. So Debbie is saying, what if we have to give personal care when a resistive client is in bed and the bed is low? Give your thoughts on that.
Oh my goodness. So the bed is low and you're giving personal care. Well, again, the emphasis is optimal start position. So in the community, I know it's difficult, but I would think in the companies I've worked for, we would try to bring in equipment that helps get that bed into the right position, whether it is a hospital bed. I know that that's a difficult one, but I think, again, it's who are you working with, which CCAC is supporting you, and if that's going to be ongoing care over a long period of time, then I think you somehow want to be able to raise that person so that the PSW is not in obviously a very bad posture. Or you're going to find another way to do that care. If there's a way to do that care in another way, then you're going to do it.
Sheila, we had a comment, and we could probably mention this.
So thank you for that answer, and then we'll move on to Emily, and then we'll take the rest of the questions at the end of Emily's presentation, and you can decide.
Okay, and Catherine's just reminding me that we will answer all your questions at the end.
Correct. Okay.
And here comes
over to Emily.
The family not wanting equipment. And I do believe that's common. We don't want to damage our floors. We don't want to damage our ceiling. I would think that takes some negotiation skills that that you're going to remind, again, the balanced decision making, the human rights and the needs of the caregiver, as opposed to the client, that we have to use some equipment. Now, I know in companies I've worked for, when we give out little brochures about the rights of the client, or we also give out a little brochure that has the rights of the caregiver. So you would be emphasizing that we've got to produce a safe work environment for our employees, and we can't put them into positions that deliberately put them at risk. So I don't know whether that answers your question, and I know it's not an easy one with certain families, but it is balanced decision making. It respects the rights and needs on both sides. Does that help?
Thank you very much, Sheila. And then we'll turn it over to Emily.
All right, I know there are a lot of questions, so I will not take too long. So putting it into practice. Now, as Sheila mentioned, I'm very interested in bathrooms and the challenges in bathrooms. And that was originally what I was going to talk about today. But when we were putting together this webinar, we realized that there's a larger opportunity. This is the highest subscribed webinar that the client or patient handling community of practice has had. I see we've got more than 60 people on the call right now. Even more than that signed up and I suppose weren't able to make it. Now the people on this call, you've signed up for a reason. Looking at the registration list, it looks like most people participating in the webinar are responsible for training personal support workers or establishing and running injury prevention programs largely targeted at personal support workers. Now, we know, and I think you acknowledge by being here, that there's a huge need for better injury prevention programs for PSWs. And so we assume that everyone participating in today's webinar came looking for tools and resources. Now, one of the challenges in putting these together is that personal support is not a subset of any other profession. It includes skills and abilities performed by many other professions, but always within the overall scope of what the client would or could do for themselves if they had full function. And this is the Personal Support Network of Ontario's definition of personal support work. And I think it fits very nicely with the framework that Sheila just presented. So we each have something to contribute to this. A number of clinicians are on the call. Occupational therapy, physical therapy, nursing, speech therapy, and personal support. There are a lot of ergonomists on the call, and we have people on the call with teaching expertise. So we are building a community of practice here. So how can we leverage this community of practice to come up with a better set of resources, better tools for all of us to use to bring down this really horrific injury rate amongst personal support workers, who I've found typically to be incredibly nice people trying to do their best to help their clients to lead better lives and to be as independent as possible. So how can we leverage this community practice to address that problem? So I've got a first poll question here for you that Bettina can bring up. Do you currently have resources? Could we see a little larger the poll question, please, Bettina? Do you currently have resources or injury prevention programs for PSWs in place? That you're responsible for. So we'll give a moment for results to come in there. So I'm seeing numbers starting to stabilize. We'll give you another couple of seconds to get your responses in. And could we broadcast the results to that to everyone? Sorry, can you see the results? Okay, so we're seeing most of the people on the call do have some kind of resources and injury prevention programs in place that they're responsible for. Some people don't. And let's go to the next slide, please, the next poll. Looking honestly at the setup that you have at your current program, how effective do you think the program is at preparing personal support workers to provide the high quality care in the way Sheila was talking about while keeping themselves safe? Do we have that poll up? Not yet. Sorry, Bettina, we're just waiting for the... Okay, so we've got a lot of moderately and slightly coming up, and this looks like most of the people who responded that they do have programs. So the 3 of you, 4 of you with highly effective programs, I'm really hoping that we can learn from you. Everyone else, I think we're acknowledging that there's a gap in a lot of the training materials and the resources. So we can move on from this. So for the chat box, if you could just share some of your ideas, what tools would assist you most to improve your current education, your service delivery, your injury prevention programs? What are you most interested in getting from this group towards promoting personal support worker safety? Funding. Yes. We do need to make a better case for funding. Suggestions specifically for bathing. Deirdre, I'd love to talk to you later. That's my thing. Injury prevention program. Transitioning from training to practice. Yep. Improving the education, having physical demonstration as opposed to online reading and tests. Yeah, you really do need that hands-on. Funding for ongoing education. Yep. Videos demonstrating best practices. Hands-on for new employees. Funding support from funders. Champions at the site. Personal accountability and reporting challenging environments. Encouraging people to feel safe to do that, I would add. Injury prevention program, ability to assess practices, hands-on training. Okay, I'm going to let answers keep flowing in. Please don't stop just because I stop. Oh, I just want to say though, personal support worker training for PSWs in the community versus long-term care, they are different. There are similar principles, but the environments are different. So please keep sharing. For the material that you do have, would you be interested in having the material reviewed by people with clinical experience, with ergonomic expertise, with training expertise? Would you be interested in that kind of review for your materials? Oh, we've got another poll coming up for you. As you see, we're really interested in understanding, there's a huge need. Let's understand exactly what that need is and how we can direct the community to meet that. So we've got a lot of yeses and a no. Okay, let's close that poll and move on. So we do have a lot of people who would be interested in having their material reviewed by people with multidisciplinary expertise. Now, possibly the more challenging question is, if it allowed the material to be reviewed by a multidisciplinary team of experts, would you be willing to share it or some of it in a community repository? And so we've given you a few options here. In addition to yes and no, we have yes, but I'd need to check about permissions because we know people put a lot of effort into developing these materials. Possibly no, but I'd share it with an academic team that would not directly share it beyond that. Or no, that wouldn't be of interest. Okay, so we've got a fair bit of interest, but some concern about permissions and possibly proprietary training programs, which sounds pretty reasonable. So let's end that poll. So before we do that, a wrap up. So one of the things that we were considering within the group presenting this webinar is trying to create an opportunity for that kind of expert review of material. And we wanted to, I guess, poll you to see if that is what would meet your needs, or, and this is an opportunity to keep sharing in the chat box, if there are other things that this community could provide that would help to meet your needs for better programs, better training to keep your PSWs safe. So that's something that we were interested in. We'd like to go back and talk about exactly how to carry that forward. But certainly, if that would be helpful, if that would help to address the major needs, then that's something that this community could be interested in taking on. And if you would be interested in participating in that kind of review process, then certainly let us know about that as well. We'd like to build a community. We would like to ensure that the expertise of people who are involved in these programs right now is incorporated, and hopefully working together we have the expertise needed to build those better, hopefully no injury programs, at least much lower injury programs, while still providing the high quality care. So I think we'll open the webinar to questions. I'll invite Catherine back to field those.
Thank you, Emily. I just wanted to mention that one of the many reasons, as Emily has indicated, that we have put this community of practice together is not to just talk at you, but to embrace your challenges. And CRE-MSD does have funding through seed grants, so there is an opportunity for us, should you be interested, in looking at materials in a multidisciplinary fashion and coming up with some evaluative framework, and then potentially a better practice content. So we will follow through with your chats, and in the meantime, we now have an opportunity, if you have any direct questions, if you wanted to have Sheila answer any questions, myself or Emily, maybe you could just type in the chat box and we'll have Henry try and sort out who would be the best person to answer that question.
Okay, so one of the questions is who currently has materials to share. So I think that's perhaps a big question. If anyone does, and they're willing to share right now their name and their organization, they could type it in. But the next one is probably for Sheila or perhaps Emily. What do you recommend for providing a hands-on grip for transferring or walking if you don't use a transfer belt? Sheila? Can you see the question, Sheila, or
Juana, yes, it's Sheila. I can see the question, and the question for others is, what do you recommend for providing hands-on grip for transferring walking? If you don't use a transfer belt. Now, when can she specify when she says transferring walking? I'm not quite sure what she means.
My thought would be transferring or walking or ambulating a patient. So how would you hang on to them? How would you grasp and where in order to get them?
Okay, so if it's assisted walking, obviously it depends a lot on the client that you've got, and kind of what if they have a weak side or a strong side, and what their abilities are. The assisted walking that often gets used is that you are walking with the person. You are doing a forearm grip. I wish I could show you this. So the client is putting their hand onto your hand. Your other hand is crossing their back and resting just above their hip. So they have a hand grip and a forearm grip, and a hand on the far hip. If someone wants pictures, I could certainly send them a picture of this, if that would help. Again, it would very much, again, it would also demand some assessment of the client you've got as to the grip you would use. I guess what we do emphasize is not to do that hand grip where the client has put their thumb around, or their thumb around your thumb, and they have really a death grip on your thumb. We want you to be able to remove your hands quickly if that client gets into trouble. So again, it's flat hands. The client has their hand on your hand, but they do not have a grip on your thumb. So I can certainly send a picture to someone if they want to get, I think, better to look at a picture of this.
Okay. So the next question is, I would like to see more personal accountability and manager accountability to reinforce with staff the importance of safe work practices and a safety climate. I think we all would like that. Good point, Janet.
Bathing in small bathrooms.
Yeah.
So that is, of course, always going to depend on the exact layout of the bathroom. That's always the caveat, right? When I've analyzed bathing, I found that the highest stress activities, and this should probably agree with what you've experienced, tend to be lifting the legs over the edge of the tub if the client requires assistance with that, and washing the feet. When I've looked at lifting the legs over the edge of the tub, something to extend your reach helps. There are little leg lifters. The one that I evaluated was probably about just over a foot long, plus a loop at the bottom. Basically a forearm's length. And if you use something like that to help lift a foot, and I'm sure there are budget versions you can come up with TheraBand or a towel or something I've heard from PSWs, you're not bending as far while you're doing the lifting. That is one simple step that can be taken if that's a problem. For washing the feet, the biggest barrier appears to be the cleanliness of the bathroom. You're bending less if you're closer to the feet, which are around ground level. Many people are not willing to get near ground level if the bathroom is not clean. So the people I've talked to who are most willing to be it kneel beside the tub, sit on the edge of the tub, sit on a stool next to the tub, something to get them closer to the feet. The people who are most willing to do that are the ones who are paid to clean the bathroom first. So I've seen cleanliness as really the biggest barrier to safe postures while doing that. Otherwise, people are standing, hanging, stooped over, often, lifting the foot briefly and providing sometimes a very thorough wash and inspection of the feet. So that can be quite a long time spent in a very poor posture because the bathroom's not clean. Or in some cases because agency policies require them to stay on their 2 feet at all times. And this is where I've heard some pushback from supervisors, is that they say, what if something happened? Our worker needs to be on their feet. But for the what if, and because PSWs are not, I guess, allowed to make that choice themselves, they're standing in a very bad position for quite a long time sometimes. So those would be my thoughts on those 2 activities. Deirdre, did you have any other parts of the bathing process that were of particular concern that you'd like to talk about?
Emily, it's Henry.
Yes.
One other method is to put a shower chair in the tub and then have them sit on that if you can use a shower nozzle, and then they might be able to lift their legs or put their feet on the edge of the tub.
Yes, sorry, I didn't mention, I was kind of assuming a shower chair or a transfer bench was in use. Okay. But absolutely, that's a good point to make explicit. And sometimes at least the near foot can get up on the edge of the tub. With the far foot, it can be a little harder, but absolutely, if they can, that will help. Good point.
You do have someone.
I'm just waiting. I see that
Deirdre, yes, is chatting. So if you just want to hang on, Emily, she might have a follow-up.
Okay,
Great suggestion.
it addressed the question.
Do
Excellent.
we have any other questions? If anyone wants to type them into the chat bar. Okay, it doesn't look like we have any other questions. Catherine, do you want to do a next steps?
All right, it's Catherine back here again. So does anyone have any final questions for Sheila or Emily? And I see Wendy is typing. We have some great expertise here, so I'm going to use it while we can. And Wendy has emphasized it would be nice to see a standard across the board for best practice. So that is an excellent comment, and I think that is certainly the next steps in terms of what Emily was being able to draw out from the crowd. It seems that there are resources out there. People are interested, if they have permission, in sharing those resources and having them evaluated by a multidisciplinary team, which would allow that team then to provide a framework that would then be able to be used, and resources, a framework and resources that would be able to be used by everyone and would in fact promote better practice. So we can certainly do that at CRE-MSD and start that process through a seed grant, and it would involve all of you who are interested letting us know once you find out if you can share your resources. We would apply for some funding to support this, to look at your resources, develop a framework, and then potentially pilot that framework within an agency or organization, institution, long-term care home. And then there's always the opportunity to apply for a knowledge to practice grant, where we can in fact generate the educational materials for use across not only Ontario but across Canada. So we are very excited. We want to not reinvent the wheel. We have an opportunity here to build on what is out there, and we know that there is some good stuff out there, but we also know from the data that I shared, not just only in Ontario, but even in the US and in the UK, there is not a lot out there. We do know that there are MSD-related injuries, and we have an opportunity now to address this.
Thank you, Catherine. So, Catherine, how do you want people to follow up? Do you want them to email Bettina if they are willing to share their resources, or they're interested?
I think that would
with this, applying for the seed grant.
I think that would be a great idea if they would email Bettina to say, I have permission to share a resource, and if we get enough interest, Sheila, Emily, and I can certainly prepare a seed grant. So we'll see what the interest generates. Certainly the poll questions indicate that there's enough interest. So hopefully people will follow up with Bettina. If you do have individual ergonomic, physio, occupational therapy related questions, we have provided Sheila and Emily's contact information, and they're more than happy to respond to you as experts one-on-one. I certainly have the ability as the Associate Director at CRE-MSD, if I see a lot of the same questions coming in to Emily and Sheila, we will put up frequently asked questions and answers on the Community of Practice COP.
Thank you, Catherine.
So we're here to support you.
That would be very helpful. And for those of you on the line, you can see that Bettina has included her email. If you were not the recipient of the meeting invite, you can click on it there. And all three of the presenters' contact information is on the slide right now. So thank you everyone for spending your lunch hour with us, and we look forward to seeing you at the upcoming Communities of Practice. Have a great week, everyone.
Thank you. We will be sending out an evaluation, and we hope to hear from you.
And thank you to our expert presenters.
Thanks, Henrietta.